Hello guys, welcome back again to my YouTube channel. If this is your first time stopping by, you're welcome, and if you're a returning subscriber, you're welcome as well. We are final year pharmacy students of the University of Nigeria, Nsukka, and today I decided to do a very casual health topic. I won't call it casual, it's actually meant to be an important health topic, right?
Yeah,
it's meant to be important, yeah, because of course it's just very important. There's no reason, it's very important. So as you can tell by the title, I want to just share why you need to know about your family medical history or your family health history. I actually got the inspiration to film these videos during one of my clinical rotations, where I realized that some patients get some diseases because, in fact, they were supposed to be aware that they were going to have that disease because it runs in their family. The last patient I met at UNTH, he had high blood pressure and diabetes. But I don't know if the patient was just ignorant or he wasn't just aware. His mom had hypertension, his dad had diabetes, and at the same time, his uncles, they all had diabetes. So it was obvious that it runs in his family, and he was supposed to know that he might have it. So his duty was to try to lower his risk of having the disease. At the same time, he's obese, which means he should have been trying to reduce his BMI. Do you get?
Yeah.
So what do you have to say?
Okay, so basically for most of the popular diseases, you find out that they are familial, that they can be transferred genetically. So a very wise thing to do is making sure that you modify risk factors to this disease before you actually come down with the disease. For example, diabetes and hypertension, I think they're the most commonest disease cases we see. And most people that have diabetes and hypertension, a good number of them, in fact majority, if I'm not mistaken, you will find out that they have family history of diabetes and hypertension. So the thing to do when you find out that maybe your first degree relative, your parents or your uncles have maybe diabetes or hypertension, the first approach should be to control your weight. You know, obesity is a major risk factor for most of these diseases.
Yeah.
So you should endeavor to work out, do exercises,
Avoid sedentary lifestyle.
avoid a sedentary lifestyle. Yes. And also you can get the instruments and monitor them regularly. I've had cases where somebody did not know he was hypertensive at all, and the first time he discovered, he was unconscious.
Probably
like,
getting to
do you understand? He has gotten
to
it has progressed, and in his case it was asymptomatic. That's the disease didn't warn him or give him signs, so immediately he just went unconscious. And you find out that some people actually die from it, and maybe you now start hearing something like,
village
he's
people
from the village.
You know, Nigerians are very religious. The village people, like he's slumped or something.
Yeah.
So you should, I think routine check is very important.
Very important.
Yeah. You know that we have non-modifiable factors and modifiable factors. The non-modifiable factor has to do with like your genetic makeup. Yeah, you can't do anything about that. It's in your blood. So, but the modifiable factors, why not try to help yourself?
Yeah,
that's just the most important thing. So I think it's very important to know your family health history or your family medical history record so as to help yourself. So it's not supposed to be, we're trying to lighten the mood, and to me, I think I'm done with whatever I have to say. I don't know if Munachi is done as well.
Okay, I also want to talk about dieting. There's a particular approach to stopping hypertension. It's called DASH, the DASH diet, dietary approach to stopping hypertension. Yes, as a hypertensive patient, or as someone who has discovered that your family has a history of hypertension, you should at least modify your diet. Take less calories, enough fruits and vegetables, take moderate protein, and also reduce salt intake drastically. Exactly. Like salt intake is one of the major complications of
and check the products you buy,
yes,
because most of them contain a lot of calories.
Yes.
As well as the fact that you have diabetes does not mean that you should cancel carbohydrates entirely from your diet. Yes, there should be a balance. And to prevent you from getting the diabetes, work on your modifiable risk factors. Thanks for watching. Till next time. Bye.